All of that, despite millions of us experiencing urinary tract infections. The NHS has recently acknowledged chronic UTIs as an official condition by updating their online advice. Dr. Oscar, what's going on? What does this mean?
Well, it means that most people who get a urinary tract infection, UTI, have just a short course of antibiotics and then they're back to normal, the infection's gone away. But there's a small group of people who really suffer with the treatment not working and they have a chronic, long-standing urinary infection. So it's been important that the advice has been updated to acknowledge that group.
Okay. So what is a UTI and what causes them?
Well, so it's urinary tract infection. So it's bacteria that comes into the urinary tract and it comes in through the urethra. So that's the tube from the bladder to the outside world. And so it's bacteria coming up that tube into the bladder, and it can even track up into the kidneys, which can cause quite serious infections. They're very, very common, and they're particularly common in women because that urethra, that tube, is much shorter, and so the bacteria can easily get in. But there are lots of things that make you at higher risk as well. So if you're a woman entering the menopause, you might have more dryness around the vagina and the urethra. That can increase your risk. If you're diabetic, particularly if your diabetes isn't very well controlled and there's lots of sugar in your urine, you can imagine that sort of sugary, nectary urine. The bugs love to grow in that. That makes things much worse. And then for lots of us, it's just dehydration, going about our day, not having enough fluids that brings things on. And those symptoms are really, really well known by lots of women, unfortunately. Burning, stinging when you're passing urine, that need that you have to rush to the loo, and when you go you don't feel you've emptied. Also, some people will have blood in their urine. That's a bit of a red flag, literally red flag, to go to the doctor if you get that as well.
It is horrible when you get it. I imagine it could lead on to other serious conditions if you don't get it treated.
Yeah, you're right. So it can become a very serious infection. You can get sepsis as a result of a UTI. I've seen when I used to work in the A&E, a lot of young women particularly who've had an infection, thought they'd just treat it by drinking lots of fluid, and that helps a bit but not enough, and it tracks up to the kidneys, and you can get very bad infections needing antibiotics into the vein. But also if you have an infection and you're more elderly, perhaps you have some dementia or cognitive impairment, then you can get much more confused, you're more likely to have a fall. It can really cause this condition called delirium, which is this acute confusional state. And I worked on the ward. I remember this lady, lovely lady, who's in for a completely different problem. Every morning, go and chat to her, completely normal. Came in one night, and she had a UTI. She was really confused, chasing the nurses around the ward with her walking stick. You treat the infection, and she's better the next day. So it's amazing how quickly you can improve things, but it can really cause a big change. So important to watch out for if you're elderly or caring for someone who.
So what can we do to prevent them? What can we are there any cures?
Is there a cure?
So the practical things are, particularly for women, wiping from front to back, so not bringing the bugs towards the urethra. That's really important. Hydrating is really important, so 2 to 3 litres a day. Don't go mad. People are drinking 5 litres a day and they're peeing for other reasons. So you don't want to do that. And then we've got lots of people who think about cranberry juice. It's well known to help with urinary infections, or so people think, but actually there's not a lot of scientific evidence that it does. There's a constituent in cranberry juice called D-Mannose, and that has been shown.
D-Mannose?
D-Mannose, yeah, D-Mannose. Okay. And it has been shown to be really effective. So in some studies it's been as effective as preventative antibiotics, and you can get these in sachets or tablets over the counter from the pharmacy. You don't need to get it from the GP. So if you're getting recurrent urinary infections, that can be something that could be really helpful for you as well.
Better than cranberry juice then, D-Mannose?
Yeah. Better than the cranberry.
Okay. So why is it important to acknowledge a UTI as a chronic condition then? Would that help your lady that was chasing everyone with a stick in terms of being able to diagnose it and you know,
not necessarily, because if for most people, as I said, you get this acute infection, you have your antibiotics, and like the lady with the stick, her confusion's gone and she's much better. This is the group of people for whom they have ongoing symptoms despite antibiotics, so the infection isn't cleared by the antibiotics. And there's another syndrome called bladder pain syndrome, where you get similar symptoms to a UTI, but we don't know the cause of that. So we need to establish as doctors whether this is caused by an infection which just isn't going away with treatment, or whether this is a different syndrome completely. So it's really important that those people get the right diagnosis, have samples of urine sent off by their GP, so we can see if we can pick up any bugs and bacteria in the urine.
Yeah, you want to get it sorted because, like you say, it's excruciating, isn't it, the pain?
Really painful, and it can cause so many other things as well, and you can get really sick.
Thank you, Dr. Oscar. Very clear.
Now, whether it's a